So we're going to be discussing the physiological concept that's part of mitral valve stenosis. So mitral valve is found between the left atrium and the left ventricle. Okay, so it's the left atrioventricular valve here. Now, it's really important to understand this physiological concept because how is it that a problem with this left AV valve or the mitral valve, remember the right one is called tricuspid, how is this problem leading to right ventricular hypertrophy or right ventricular failure eventually? So let's talk about it. From the start, what happens is that especially when there's mitral valve stenosis, stenosis is an abnormal narrowing of the valve. And this abnormal narrowing is so much so that the gap is only 2 centimeters, when normally the gap in the mitral valve should be around 4 to 6 centimeters squared, the area, the gap. Okay, now with stenosis, that means that there is narrowing, okay? Stenosis. It's a valvular anomaly that leads to an obstruction of blood flow going from the left atrium into the left ventricle. Now, what happens in this is that, look, if there is a narrowing of this valve right here, what it's supposed to allow for is it's supposed to allow for blood to go from the atrium here into the ventricle here. Now, when that's not happening, because there is a stenosed valve, so much so that it's only 2 centimeters, the opening, compared to how big it was before, less and less blood will be able to flow from the left atrium into the left ventricle. And if less and less blood flows from the left atrium into the left ventricle, that means more and more blood will be in the left atrium. So, when there is increased volume of blood in the atrium, what this will lead to is increased volume, increased pressure. And if there's increased pressure, eventually there will be dilatation of the left atrium. Dilation of the left atrium, what does that actually mean? Well, when it starts to dilate, look, more, and if this is the two compartments, this is the atrium, this is the ventricle. Because of an issue with this valve, not as much blood is able to seep into the left ventricle. That means more and more blood is filling up into the left atrium. If it's filling up more and more, this atrium will eventually have to expand to cope with that increased amount of blood. And when the left atrium expands, there's increased pressure. And an important concept in physiology or physics is that blood flows from an area of high pressure to an area of low pressure. But if the pressure keeps going higher and higher here, that means that eventually the blood might flow backwards. And as the blood flows backwards, it might flow backwards into the pulmonary veins. And as it does so, the blood will back up. This will cause pulmonary congestion. Eventually, it will lead to edema due to the increased hydrostatic pressure. It will lead to pulmonary edema, and that's what's going to give you the symptom of dyspnea. Okay? Now, here's the key concept further. If the lungs are getting congested and there's dyspnea, right? Due to the increased congestion and the fluid buildup in the lungs, there will be something known as pulmonary hypertension. Pulmonary hypertension. Pulmonary hypertension, usually the pressure should be around 25 millimeters mercury to 26. Now, this will lead to a buildup of pressure here in the lungs. Now, we wanted the right ventricle, the blood in the right atrium to go into the right ventricle, oxygenated blood, to go from the right atrium through the pulmonary valve into the pulmonary arteries, into the pulmonary vessels. The only way it can do that is if the pressure is high here, high, and low here. So the blood can easily flow from an area of high pressure, such as here, to an area of low pressure, such as in the lungs. Now, can you guess what this pulmonary hypertension is going to do? It's going to mess up the whole homeostatic balance. It's going to mess up the whole balance. How? Because now our lungs have an increased pressure because of the pulmonary hypertension due to remember, there was increased blood volume in the left atrium. There was increased blood pressure in the left atrium. This caused pulmonary congestion. This caused fluid buildup in the lungs. This caused pulmonary edema. This caused pulmonary hypertension. Now, our right ventricle is going to have to work even harder to push against this immense increased pressure here in the lungs. And as our right ventricle works even harder, if it gets harder for the right ventricle to work, the right ventricle is going to have to hypertrophy, get bigger and bigger and bigger. And that's how an issue with the left AV valve or the mitral valve can lead to such dangerous consequences such as right ventricular hypertrophy.